What secondary sex characteristics do puberty blockers prevent? Imagine being able to pause your body's physical changes during a confusing time. That's what puberty blockers do for some young people exploring their gender identity. These medications temporarily stop the hormones that cause puberty to start. They work by blocking the releases of sex hormones like testosterone and estrogen. These hormones are responsible for the physical changes that happen during puberty. For individuals assigned male at birth, puberty blockers prevent or delay several changes. They stop the voice from deepening, which normally happens around age 12 to 14. They also prevent the growth of facial and body hair, which usually begins during this time. The development of the penis and testicles is slowed down or delayed. Additionally, puberty blockers reduce the increase in muscle mass and changes in body shape that typically occur. For those assigned female at birth, puberty blockers prevent breast development, which usually starts around age 10 to 12. They also delay the beginning of periods, which normally happen during puberty. Widening of the hips and other body changes that give a more traditionally feminine shape are also postponed. This temporary pause gives transgender and gender-diverse youth more time to understand their gender identity without experiencing unwanted physical changes. It can help reduce feelings of distress or gender dysphoria caused by the mismatch between their gender identity and physical traits. The good news is that these effects are generally reversible. If a person stops taking puberty blockers, puberty usually resumes, and secondary sex characteristics develop based on their biological sex. This approach is part of gender-affirming care, which aims to support mental well-being and reduce anxiety or depression. In medical transition, puberty blockers are often used early in the process. They give young people a chance to explore their gender identity without rushing into irreversible changes. If they choose hormone therapy later, puberty blockers can help ensure that the physical changes align more closely with their gender identity. Overall, puberty blockers prevent the development of secondary sex characteristics such as breast growth, facial and body hair, voice deepening, and changes in genital size. They do this by temporarily stopping the body's production of sex hormones during puberty. This pause is reversible and provides important support for transgender and gender-diverse youth during this critical stage of growth.